Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Susan, a woman living with an NTRK gene fusion. It's a rare genomic driver that drove her thyroid cancer. Welcome to the program, Susan.
Thank you, Neil. Glad to be here.
Give our listeners a bit of your background. Who is Susan?
Sure. Well, I'm a thyroid cancer survivor. I was diagnosed in 2004. And then almost 4 years after my initial diagnosis, after a thyroidectomy and having radioactive iodine, my cancer returned. So in 2008, and continued for many years until I was diagnosed with NTRK positive thyroid cancer. My cancer was progressing through that whole time with multiple treatments, multiple surgeries, and then I was finally diagnosed with NTRK positive thyroid cancer.
Your initial diagnosis in 2004, was it a proper diagnosis in the beginning, or had you been diagnosed incorrectly prior to your diagnosis?
Well, that's a good question, and the medical technology has changed so much. But when I was diagnosed in 2004, I was told I was stage 1, and that I'd be 98% cured, and to take my Synthroid and I'd be fine. And that was not the case. So
they thought you had an underactive or an overactive thyroid?
I had a tumor on my thyroid that was cancerous. So I actually have follicular variant of papillary, which is under the umbrella of papillary thyroid cancer, which is the most common type of thyroid cancer. Now,
you say you went through several unsuccessful rounds. Obviously, this is a new form. You were diagnosed with a new form of cancer, right?
Right. It wasn't until the beginning of 2018 that I had genomic testing completed, and that's when it was discovered that I had the NTRK positive thyroid cancer, which is NTRK is a gene fusion. So your NTRK gene, any one of them, fuses with a whole nother gene and makes it the driver for your cancer.
Well, how did you even learn about genomic cancer testing in the first place? Were you referred by a physician, or did you do some research on your own?
So I knew about genomic testing because I belonged to a bunch of thyroid groups, and I heard about it, and I knew it would somehow change my course of treatment, but I really didn't know the specifics. So as my cancer was progressing, I was running out of options, and my current doctor, who was an endocrinologist, recommended me to go to another hospital. It was a major institution here, to learn about a different clinical trial, actually to give me more radioactive iodine. It was a pill you would take that would make my thyroid cancer uptake radioactive iodine and hopefully kill it. So I really didn't want to go on that visit because I already had so much radioactive iodine. And I was up at that appointment, and the oncologist there, which was the first time I saw an oncologist, he said to me, your cancer shouldn't be acting like this. This isn't normal. Let's do genomic testing. So as soon as he said that, I'm like, sign me up, get it done, and let's see what it says. So I was very excited that I went on the appointment that I didn't really want to go on.
When this cancer was diagnosed, this NTRK, had you ever heard of it before?
No. I'd never heard of it. I was in shock when he called me. He said, I have good news and I have bad news. The good news is, or the bad news is you have a rare mutation. The good news is a drug that will target this fusion, and we're seeing really good results in the clinical trial. So the TRACK study, I met, I was asked back in 2018 after I started my clinical trial for NTRK positive cancer. I was asked to talk at the NORD conference inside at Washington. And it was at that panel discussion talking about precision oncology, because then the drug I'm on targets my fusion. But when I went to the NORD conference to talk about precision oncology on a panel, I met Jim Palma there, who runs or president of TargetCancer Foundation. And after he heard my talk and my story, he asked me to participate on the advisory board of forming the TRACK study. So it was myself and I believe one other patient where we, met with him and went over his website that he was developing, the paperwork that would be going out to patients to basically get the patient perspective, because he thought that was so important. And being a patient myself, I thought it was very important as well. He set it up as a clinical trial where rare cancers, they'll have 400 enrollments and basically do genomic testing for free, which is great because people aren't getting their tumors tested correctly. So this is a great service for people in the rare cancer world.
Well, I know that you've learned about the importance of genomic cancer testing. What should other people know about it?
Well, there's different types of genomic testing, but really what the important message is to have your tumor sequenced for different biomarkers. And that testing if your biomarker matches up to a therapeutic drug, then you can specifically target your cancer or at least help that mutation or whatever it would be. Just like myself, I'm on a drug that specifically targets the NTRK gene fusion. So it's very, very important that people with metastatic disease that are not being helped with traditional therapies have their tumors tested.
Now, is this something that is readily available, or is it extremely expensive?
It's expensive. Some, not all insurance companies are covered it. In my case, my insurance company denied it. Mm-hmm. It can be expensive depending on what type of test. But yes, we need more awareness around the importance of genomic testing and getting insurance companies on board as well to complete it, and then complete it at a way that patients can financially afford it.
So what's the one piece of advice that you'd like to pass on to others who've been newly diagnosed?
To be your own advocate, do your research, keep asking questions, don't be afraid to ask for genomic testing, and also get, second, third, fourth opinions if you feel you need it. And just don't stop. I mean, have a lot of hope. There's a lot of new drugs coming out that can target cancers. It's really an exciting time to have cancer, which was kind of weird to say, but there's so many new drugs that are coming out that are so helpful for patients like myself that it really is. It's exciting, but just have hope.
Well, where can patients go to learn more, or if they'd like to enroll?
The TRACK study at www.TargetCancerFoundation.org/TRACK, and they can find information on that TRACK study.
Well, I appreciate you taking the time this evening, Susan. Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.